Okay, you should be able to access the chat now. So those who are just joining, we're getting started in just a couple of minutes. And as you are joining, please add your name, where you're calling in from today, what organization you're working for, or what position you're working in, and if you have had any experience working in the intersection of social and behavioral sciences and digital health. And we are a couple of minutes past the hour, so we're going to go ahead and get started. I'm going to hand things over to our moderator, Stephanie Watson-Grant, who's a project director at JSI shortly. But before we do that, I'm just going to go through a couple of housekeeping items. So as you're joining, you've probably already realized that you are muted and you are off video, and that will remain the case throughout the webinar today. However, we do want you to participate, and so we ask that you do that through the chat. So please feel free to comment and engage in the conversation that way. If you have any questions, please use the Q&A feature to ask questions. That will make it easier for us at the end to corral those questions and make sure that we get to as many as we can in the time that we have allotted. This webinar is being recorded today, and we will be sharing the recording after today's conversation for everybody who is registered. There is live French interpretation available, and I will get into that in a little bit more detail in just a second. But if French is not your primary language and you'd like to follow along in the webinar in another language other than English, there is the Zoom caption feature that is available. If you go to the bottom menu bar, you're able to show and hide captions and then select the language that you would like those captions to be in. To access the French interpretation, again, navigate to the bottom menu bar on your Zoom screen, and there's an interpretation button circled here. Click on that little globe, and then you are able to select French as your language for today. And I think that is it. So I am going to hand it over to Stephanie to get us started today. Thank you.
Great. Thanks, Lauren. Good morning, good afternoon, good evening, everyone, and welcome to JSI's live cast, The Behavior Effect. My name is Stephanie Watson-Grant. I am the project director for the JSI-led Country Health Information Systems and Data Use Program, also known as CHISU. So today's focus is on the intersection of change management and digital health. Our guiding questions for today's discussion is: how can applied behavioral science improve the design and uptake of digital tools to improve health outcomes or strengthen health systems? I'm sure you've heard the words digitization, digitalization, and digital transformation. And have you wondered if there's a difference? There is. So digitization is the translating something that was analog into digital. For example, changing a paper data collection form into a digital form in a health center. Digitalization is the use of digital technologies to change the way we do some of our business. So an example of this is digital data collection forms becomes just one of the many digital processes used in a health center, which may or may not be connected. Other processes include registration, payments, labs, screenings. And then there's digital transformation. And this is the comprehensive integration of digital technologies into our business, transforming how people, processes, and technology interact. An example are all the products and processes in a health facility. They're all digital, they're all linked, and there are new workflows based on recognized efficiencies, and these workflows are being practiced. The health workers who were a part of the design for these systems, they're trained how to use them, and they're an integral part of these systems becoming fully functional. So as more and more of our processes become digitized, or transformed, change management becomes critical. But what do we mean by change management in the context of digital health? And why is it important? And how can applied behavioral science help? So change management in digital health refers to the structured approach used to guide individuals, teams, policymakers in adopting and adapting to new digital technologies within a health system. It is critical to transforming innovative technologies into actionable, sustainable improvements in healthcare delivery and patient outcomes. Without it, even the most advanced digital solutions risk underutilization or failure to achieve their intended impact. In the Board of Innovation's AI Strategic Playbook, CEO was quoted as saying, "For every dollar you invest in tech, invest $2 in people and change." And we agree. Applied behavioral science can help by providing the necessary insights into human behavior and decision-making that will point to strategies that can leverage facilitators and address barriers to change. Today, we have 4 very experienced and diverse colleagues joining us from various places who will reflect on their experiences on the intersection of behavior and digital health and propose actionable insights that we might all take on board. I'll let each of them introduce themselves briefly to you. So I'll start with Joy, and then we'll move to Tariku, Judith, and Wesley in that order. Over to you, Joy.
Thanks, Stephanie. Hi, everyone. My name is Joy Kamunyori. I'm a Senior Health Information Systems Advisor with the Office of HIV/AIDS in USAID's Bureau for Global Health. I have been working in digital health across sub-Saharan Africa for the last 16 years. Thank you.
Thank you, Stephanie. My name is Tariku Nugatu. I'm working for JSI in Ethiopia. Here I'm working to improve the quality and availability of health services through the deployment of data-driven and patient-centered digital tools. I've been working in public health in Africa for over 20 years, and for the last 5 years, I've been working in a digital health project in Ethiopia. Thank you. Over to you, Stephanie.
Judith, please go ahead.
Yes, good evening all. I'm Judith Nyongesa from Kakamega County in Kenya. I coordinate community health services in the county. Professionally, I'm a public health officer with over 20 years experience in the field. Thank you so much.
Great. Go ahead, Wesley.
Yeah, good afternoon, good evening. I don't know where time it is. My name is Dr. Wesley Oga. I work in the Ministry of Health. I currently head the acting head of the Division of Health Informatics, Innovation and Digitization in the Ministry of Health, Kenya.
Great, thank you all. And thank you all for being here and lending your experience and your expertise to this conversation. So I'll start with Joy with my first question. When digital health initiatives fail to achieve widespread adoption, in your experience, what has that failure been due to? Infrastructure limitations or more to do with people and the difficulty of changing current practices?
Thanks, Stephanie. So inadequate infrastructure is definitely a constraint, but I would say that, if the expected users are not involved in the design and implementation of a tool, the chances of failure are high. So, employing user-centered design approaches is crucial in delivering tools that work for the user so that they actually want to use the tools rather than, which then leads to widespread adoption. Of course, user-centered design should also take into consideration infrastructure constraints, in the sense that a functional tool should take infrastructure, should be able to function in within the infrastructure context that exists. You also need to make sure that change management approaches are being applied. You need to work with people on helping them to understand why a tool makes sense, how it will fit into the existing procedures and business processes, what might change and how, and make sure they're comfortable with all of that. And lastly, you need to make sure that users are comfortable with the technology itself. For example, are they phone literate? Are they tablet literate? Or are they computer literate? Just to give a very quick example, early in my career, we had worked on implementing a decision support tool that we thought would solve all the problems of the health workers that we were working with. But after we had trained them and left, we learned that they were not using the tool anymore. And when we followed up, we realized it was because they felt uncomfortable with the tablets. And they were worried about breaking them when we were not there to supervise their use. If we had involved them, if we had taken a user-centered design approach, we would have picked up on their discomfort, and we would have worked with them to make sure that they were comfortable with the devices that they had been issued. So, when it comes to digital adoption, when we're changing practices from paper-based to digital, the why really needs to make sense to the user. The tool needs to be making their lives easier on some level, and they need to be comfortable with it in order to achieve true adoption. And so that's where I would say change management and user-centered design comes in. Thank you.
Thanks, Joy. So you talked about the why. I'm going to turn over to Tariku. Tariku, you've been involved in the widespread adoption of digital technologies in Ethiopia. And I wondered if you could reflect a little bit on how that process went and how the why was translated to the users, or anything you might have learned from this widespread adoption in Ethiopia.
Thank you very much, Stephanie. As Joy mentioned, digital adoption infrastructure is a big problem for digital adoption. That is well understood. But other than infrastructure, there are barriers like attitude of health providers or the intended users towards digital tools. Training is also another important thing, like how they are comfortable, as it has been mentioned earlier, to use the digital tools. These are very important factors when it comes to accelerating adoption of digital tools in the community. We have seen that in places, for example, where I'm now in Addis Ababa, where the infrastructure is better, the digital adoption might be affected by providers' attitude. For example, when it comes to use of electronic logistics management information system, when we introduced this system, it helped prevent product leakage that was left unaccounted for. But now, when the electronic logistics management information system is introduced, then we were able to create accountability for lost products that are expired, more than what we used to do when we are using manual systems. So providers, they feel, especially when it comes to accountability, they may not feel comfortable when systems being introduced are bringing certain accountabilities, or when they are feeling like those systems are preventing thefts or preventing leakage of certain products. So other than infrastructure, attitude towards digital products, training are important parameters that we need to consider when it comes to accelerating digital adoption.
Thanks, Tariku. Wesley, I'm going to turn over to you. So our big question is, how can applied behavioral science improve design and uptake of digital tools to improve health outcomes and strengthen health systems? But let's just break that down a little. That's a very big concept there. And so I want you to just give us some advice. What advice do you have for shifting a country's health system from a culture of resistance? So this attitude that Tariku mentioned, this culture of resistance, to a culture of innovation, adaptability, when implementing digital health solutions?
Yeah, thank you. I think the first thing that is important to note is majorly one of the few things that we get with digitalization is change resistance. So a very well planned, or rather a good structured plan of how change management is going to be countered is very, very key, because a lot of the time when people perceive change, they don't perceive it in the positive manner, but more of look at it like, what is my security? What are the things that are going to change? Is this system coming to get rid of me? So the first thing is being able, number one, to look at change management and look at how the things are. Then the most important thing, as you said, is the people's. How do you communicate with the people? What's the agenda and what are the benefits that this particular change towards digitalization will be able to bring to whatever they're doing? For example, what will be the end outcome towards patient care? What will be the outcome towards the workers? Because most of the time, why we're doing digitization is to reduce the burden of writing. Like in Kenya, the health workers will actually literally complain that 80% or probably 30% or 40% of the time is spent on writing. So if you can be able to tell them how this digitalization solution is coming in a good way to make them focus on the key output, what they're supposed to do, then that will be able to really help in pushing. And just like any other society, there's also the resistance on issues to do with data privacy and security. So at the leadership level, if you can be able to assure people that this data will be safe, everything will be okay. We're only going to use this data for health. We're not going to look about it, especially maybe for issues to do with taxes. We're not here to look for criminals. Our main aim is to be able to use this particular data to deliver healthcare. And such assurances, I think, would be able to really work very, very well. And lastly, the thing that I've realized really kind of gets people award very far and helps push the change is if you have champions at the lower levels, so that within the facilities we have people who come around, they're the key, they're the champions, they guide anybody, because anytime they're stuck somewhere, there's someone that is there to help them and give them technical support very, very well. And lastly, being able to recognize and award, because human beings generally really love being told you've done very well, you've really done very well here, thank you, you're doing very well, you're the best, and this kind of things. They really help it was envisioning and ensuring that whatever digital solution or whatever digital solutions you're implementing, they tend to really take up very, very fast. Thank you.
Great, thanks, Wesley. Speaking of champions, Judith, a question for you. So Wesley talked about planning for change, and you're at the forefront of the use of these digital technologies in the communities and the facilities. So I wondered if you could reflect a little bit on this planning for change as it relates to digital technologies, and how that that planning and implementation at the community level has a very positive effect, or if you have some reflections on your experience with this with the change process at the community level, would really like to hear that.
So thank you so much for that. And while reacting to that, I'll take the community perspective. One, before maybe you initiate the change, you have first to engage or involve the stakeholders from the first step, so that as you go through the step, they feel part of the system, they own the system, and they're ready to go through the system freely, because from the word go, you've engaged them. So on this, they will not maybe take the system, reach somewhere, maybe disown it, or reach somewhere, say it is not good or it's not working. So if you engage them from the word go, they'll be able to own the process. Then secondly, when you are now engaging them, you clearly communicate the benefits. Out of that process, what benefit, positive benefit will they get? So if your benefits outweigh the disadvantages, I'm sure they'll take up the process, they'll own it, and they'll work with you. Then apart from that, healthcare workers normally have that fear for the unknown. If maybe I take this digital pathway, what will happen at the end? Where will I lead to? So one, you clear the fears, you tell them the positive ways. And then even in the process, as they go ahead, as a way of motivation, you can arrange maybe a session where you can motivate the best healthcare worker. You can maybe motivate, if it is at community level, the best community health promoter. At community level, you can also motivate the best community health unit, maybe give them a reward, maybe a recognition, so that it keeps them moving, it keeps them maybe saying, I'm the best, I can work this. And this one also gives that morale for the rest to keep on or work better, so that in the next reward, they be among those that have received that reward. And then also on the same, training is very key. Before maybe you engage them, you have to give them that comprehensive training. You take them through that comprehensive training, so that as they undertake the process, they're able to implement what you trained them and to go through the process. In case of anything, in case of any issues, there is somebody who can respond to it. There is that maybe the supervisors, immediate supervisors, let me say at community level, if there are community promoters, there are community assistants are there to respond to any issues. They are there to advise, they are there to do the support supervision, both physically or even online using the digital systems. And in case of any queries, you can also organize for a physical meeting whereby each one of them gives their views and you get solutions together as a team. Thank you, and back to you.
Thanks, Judith. We're beginning to hear some themes here. I'm hearing Joy talked about the why, Wesley talked about the benefits, and Tariku talked about the attitude. So we're beginning to hear some clear themes coming through. Tariku, my question to you. So you've analyzed the various barriers and facilitators to digital health adoption. In your experience, what role should leaders play in ensuring the success of digital health transformation, and how do they avoid becoming bottlenecks?
Thank you very much, Stephanie, for the question. I think leaders need to do 4 things to support the digital transformation. The first one is they need to allocate adequate resources to meet the quantity and quality of infrastructure needed to drive digital transformation. I emphasize quality and quantity of infrastructure because if the quality of infrastructure that is installed does not support the demand, then there can be backsliding in digital transformation and digital adoption. The quantity of infrastructure is also very much important. If only certain departments have the gadgets and the remaining departments in a health facility do not have the gadgets, then it is very difficult to bring about digital transformation. Therefore, one of the most important things to do is to allocate adequate resources. It can be by mobilizing local resources to meet the quantity and quality of infrastructure needed to bring about digital transformation. The second very important point, some of my colleagues already mentioned, is the need to motivate health workers and the community to adopt digital technologies. It is very important that leaders set standards and incentivize health workers that champion digital technology adoption. This is very much important, motivation. People have to understand why they need to use digital technologies. The benefit is both for the health provider and also for the community, patients or clients coming to them. And therefore, it's very much important to demonstrate the benefits and also to implement both financial and non-financial incentives as applicable to that setting. The third very important point that leaders need to do to bring about digital transformation is to bring all stakeholders on the table to support the digital transformation. Because digital health is not only a health sector issue. You have telecom operators. You have also other actors to make manufacturers, gadget manufacturers, that are important stakeholders when you talk about digital transformation. So it is very important that these all actors, not only people in the health sector, but also people in the education sector, agriculture sector, and other sectors, including telecom operators and manufacturers, need to come together to bring about the digital transformation that is required. The last and my fourth point on this is leaders to be open for continuous learning and improvement, because technology is advancing day by day. So leaders need to keep an open mind to learn and to improve the implementation of digital health, so that they can bring about digital transformation and keep up pace with the rest of the world. Thank you. Back to you, Stephanie.
Thanks, Tariku. Really, really well articulated there. Wesley, I'm going to come to you as one of the leaders that Tariku was talking about in his statements here about, resourcing the transformation with quantity and quality and motivating users. You also talked about communicating with the people, and I wondered if you had a specific example of where something went really, really well and what you might have learned from it. Tariku talked about continuous learning, or where something didn't go as well as you hoped, and also what you might have learned from that.
Yeah, so I think one of the few things that, especially in the African setup, which we tend to forget is the political goodwill. And especially in digitization, if the political goodwill is there, that is the leaders within the political class, then it really, really becomes easy. I'll give you an example of Kenya. Kenya rolled the electronic community health information system, where the community health promoters are able to visit household using a mobile device, either a tablet or a phone, and they're able to deliver the community health intervention digitally to the service. We were able to learn very, very well because the top leadership, starting with the president, he took a leading role, informing everyone, taking part in the launch, accessing different households as a PR, and during the launch, accessing a household and actually carrying out the whole interview on a digital platform. And this really gave us quite some good political headwind, because everyone now felt like this is the direction the country was going. So I think that really, really gives a very, very good perspective of how well something is done well with the political class, supporting your leadership, with everybody as a country feeling the need to adopt it because they have a feeling that it has been taken from the top, and so it's for the good and the common cause of all. Something again, probably I would not be able to say we don't learn well is when deploying the systems, the ability to interoperability and being able to communicate across every other system that would be already working within the sector. Because one of the few things we realize is that we shall have different sources of digital health solutions, and the ability to ensure interoperability and the ability to share information across, so that, for example, in Kenya, our lesson we learned is that we had an insurance system that could not communicate with our EMR, that probably could not communicate with our client registry. So it really became a very, very major hindering block towards that success. And so those are some of the things you learn when you learn on the job. And the problem is it creates an issue of confidence and crisis, because sometimes people want the service, they cannot be able to access it. They really don't want to know whether it's an issue of you and the system and interoperability. For them is that they need a service, and as it is at the moment, they cannot be able to receive a service. So it really, especially for Kenya, which is a little bit of digital savvy, you realize all of a sudden you're trending on all the social media, you are receiving a bashing, the loss of confidence, and this really impacts on the healthcare workers who we need them to adopt. So that is one area I think we really took a beating, and we have taken a learning. And you realize probably now you need also to learn how to manage such situations, being able to apologize, being able to explain to the public what was the problem, and then be able to restore the confidence once again. I think those are some of the few things I've been able to learn on the deployment. Thank you.
Great, thanks, Wesley. And we go from our leader to our user. Judith, you've been on the front lines of this digital transformation in Kenya. You are some of the people that Wesley was referring to in his example just now. And we'd love to get your perspective on what is the most effective way to engage health workers who might perceive digital transformation as a threat to their workflow or their job security.
So thank you so much. And I'll talk from the Kenyan perspective, especially in our health facilities vis-a-vis our communities. When the digital system came, especially at community level, that complaint was there. The healthcare workers at facility level were saying, if a community health promoter can go out, visit a household, diagnose a sickness, treat at community level, what can we do or what shall we do at facility level? So what came out clearly was for the healthcare worker that is stationed at facility level, you clearly tell him or her his role. What is your role as pertains this digital system? There's that role a healthcare worker plays at facility level. There's that role a community health promoter plays at community level. Where they meet is just collaboration. And maybe if there is that situation where the CHP cannot handle at community level, this where a referral is made directly to the health facility to be handled by that healthcare worker who is stationed at the facility level. Then also from that, at the facility level, effective way maybe for handling these people is taking them through a very comprehensive training, clearly defining their role so that they know nobody's taking over their role, nobody's interfering with their role. They continue with their roles as the community or the community workers do it at their own level so that nobody is interfering or taking up the other person's role. And then thirdly, apart from that, I said the issue of giving them the benefits. If we go digital, what will they benefit as healthcare workers at facility level? One, there is that the manual work they were doing, the book and the pen, it was so tiresome. Maybe clerking a patient, doing it manually, entering in the books, re-entering in the registers. What if this digital system comes so that it does for you the remaining? So we shall see that due to that, there'll be that improved patient outcome. The workload will reduce because the healthcare worker will not do it manually. Digital systems are normally fast and efficient. Then thirdly, on the side of the healthcare worker, there'll be reduction in stress. There'll be no burnout. There'll be no fatigue. When he moves from workstation to his or her home, he can go there and continue with his home course, not just sitting there because he's tired, but he's from duty. So with such benefits, if you communicate to them, they'll know this one will relieve me my duties. I'll still have some energy to do my other work. Then when it comes also at the community level, the community health promoters do a bit of what the facility health care workers could have done. So they reduce their workload. The simple technicalities at community level are handled by health care promoters, and they leave the junk or the technical duty for the health care worker at the facility level to do it. Then also, when you are implementing this, you may have a large area to maybe start off or to do it. Maybe due to financial constraints, you are not able to. So we can plan and start small, maybe with a few facilities or a few healthcare workers. And then with time, we can now roll out the remaining part of that. We see that a whole maybe county is covered or a whole community is covered. And through this, we can also celebrate wins and see out of what we did, are we able to get something positive? If that positive thing is there, can we celebrate? And through the celebration, it motivates other healthcare workers that had that negative attitude, maybe of onboarding this. It also gives those that were not on board that morale to start again and maybe be recognized, be motivated, and people feel good when you recognize them. People feel nice when they are motivated, they are rejuvenated, they are energized, they go on with their duties. And our center of interest here is the patient. When the patient is comfortable, we feel happy. When the patient is served to the maximum, we feel happy. So when the patient goes home with that remarks, I'm happy, I'm contented, we also feel happy and we feel motivated to work more. Thank you. And
Judith,
back to you.
absolutely, absolutely wonderful. I think you kind of carried us all the way back to even our first point. the why. The why is really, really important. And so, Joy, I'm going to ask you, in communicating the why, the majority of our health workforce are females. And I wondered if there are any special considerations we need to take into, we need to bring to the forefront as we are communicating this digital transformation. I think, in the context of the digital divide, the gender digital divide, are there any special considerations we need to be bearing in mind as we communicate this digital transformation to the health workforce?
Yeah, thanks, Stephanie. I think one of the considerations we should be keeping in mind is, going back to the point about relative comfort and discomfort potentially with devices. We know that in a lot of the countries that we work in, fewer women own devices, or if they do, they're not the advanced devices that we are necessarily asking them to use. And so as we are, communicating the why, I think it's very important to also be able to explain, what it is that the technology is doing for them. Setting it up as less of a competitor and more as a tool that helps them do their jobs better. Which, and hopefully give them motivation to want to take on this new technology that they may be less comfortable with. So, really having conversations about, the fact that rather than threatening their workflow or their job security, a tool should be supporting the health workers' workflow, making them more efficient and able to accomplish more, which by extension makes them more valuable, right? And given that they have other duties probably at home, the ability to accomplish more in a shorter period of time is very important. I mean, again, this goes back to involving our female community health workers in the intervention design from the earliest stage possible, in order to allow them to understand and inform on how a digital tool would be most useful to them. And Judith touched on this a little bit on the subject of motivation. I think one of the things we can communicate as we are trying to manage change is also trying to manage how the tool is perceived, in the sense that, trying to make sure it's perceived positively. So, for example, in speaking with some community health promoters in Kenya, there is, having this tablet and being able to go into homes and use this tablet is actually viewed as prestigious. And so, it's a small thing, but it is still motivation for, people, these people who are working at the community, to have that prestige of having a tablet that they're entering information in. And so playing up some of these aspects, can, I think, be also very important. Thank you.
Great. Thanks, Joy. All right. My last question, my last formal question is to you. And how should we measure the success of change management in digital health? Is it about the adoption rates? Is it about the return on investment? Is it about patient outcomes or something else? Based on your experience, what do you think?
Yeah, thanks. It's a tricky question, as always. It's very difficult to tie, patient outcomes back directly to digital health. There are so many other factors that can affect patient outcomes. That said, I think, adoption rates and effective use can be good indicators of how successful a change management process has been. If the tool is being widely adopted and has been fully integrated into the day-to-day operations, So much so that people are using it reflexively, right, without much thought, not just to report data, but also to make decisions and plan health programming within their individual spheres of influence at all levels of the health system. So, for example, with the Kenya ECHIS, we have the community health worker who's using the system at, within the community. This empowers them to plan his or her community interactions. Then you have the community, the CHA who is supervising the community health promoters, being able to use that tool effectively to supervise the community health workers within their community health unit, and then having the health facilities being able to refer and to receive referrals from the community, and determine how much stock to order based on the use of stock at the community level, and also and then the county and national governments being able to use the information that's coming from the ECHIS to plan for and respond to outbreaks, for example, or to stock shortages. Seeing a tool used at all levels of the health system like that really is adoption and effective use, right? And so, when we see tools being used well and appropriately as needed by the various users at the different level of the health system to accomplish their goals at their individual levels, that kind of full integration into the health system and accompanying ownership by the stakeholders who are using the system and tool, to me, shows success in the change management process. Thank you.
Great. Thank you so much. All right. It is over to our audience for questions. And we've got a couple of questions already in our Q&A, and some of them have already been answered. So thank you for those who have also given some answers here. Let's see. Our first question is from Wasinihol Bilai. Who controls digital technologies and how can we ensure they're accessible before we talk about adaptation? So I think this is a question around the rollout, this idea of the rollout of these digital technologies. I'm paraphrasing for you here, but anyone wants to take this question? Wesley, do you want to take a
Sure. Sure. So I think one of the few things we need to be awake is to the idea that digitalization, and especially the digital field, is open for everyone. So the aspect of control might not be as such a big thing because anybody can sit in the home, develop an app, develop a solution, and be able to use it at any other moment. Now, what becomes a challenge is who either licenses it or who allows it to collect data. So we have different approaches, and different countries have different approaches. For Kenya, I think we've been able to develop the Digital Health Act, which is a law, and the law actually gives you guidelines on how, for example, if you've developed a pattern technology, what are the things you need to bring it for the agency for it to undergo certification. So different countries will have different pathways of how the technologies are adopted. Kenya has gone the way of using the law and act to enable that, to ensure that, for example, any digital solution that is used in Kenya achieves about 4 different functionality. For example, it's able to be functional, it is able to be interoperable, it is able to ensure security and privacy, and lastly, it's able to make the necessary reports required by the Ministry of Health for purposes of reporting and monitoring and surveillance. So different countries will have different pathways of how technologies will be adopted. But most importantly, I think the data protection laws and maybe if they have an agency in country, those are kind of the things that will give a guideline of what can be deployed, what can be taken, and what can be adopted by individuals. But let us always remember, digitalization always will precede legislation. So a good number of time, the digital transformation will be way ahead of whatever legislation that will come up later to be able to guide us. Thank you.
Great. Thank you. Just checking to see if anyone else wanted to add anything to Wesley's response.
Yeah.
Go ahead,
maybe, I just would like to add the role of the government in setting up governance, proper governance to manage different digital systems. because unless there is this governance put in place, you can end up in having multiple disparate systems that do not talk to each other. As Wesley mentioned, it's very much important that we have a governance system. In Ethiopia, for example, we have the National Digital Health Blueprint, which is a governance document that outlines important considerations to be taken in the development of digital tools and the need for these systems to be interoperable with each other. So that is a very important thing. That is what I want to add.
Great, thank you. All right, we have this question here. How significant an issue are data security and the threat of data breaches? As healthcare transitions globally to digital health, what measures are being implemented to minimize the risk to patient data and privacy? I know that question is not specific to behavior change or to change management, but I think this is part of the trust that many of you talked about in your remarks and in your responses to different questions. So I wondered, how does anybody want to take this question and pull in this idea of change management and behavior change in data security, data breaches, patient data, data privacy? Let me see. Joy, can I ask you to take that one?
Apologies, I have a tickle in my throat. I'll do my best. I think as Wesley mentioned, having legislation that lays out, the data privacy regulations and policies goes a long way towards building that trust, right? Because you can point back at that legislation and explain, to your stakeholders that their data is safe, that there is actually a law on the books that makes their data safe, that holds those who are handling their data accountable. So that's the one thing. I think also realizing that people are intelligent and being able to speak to what types of mitigations or not mitigations, but what type of features exist within a tool that is being rolled out that help to protect people's data, things like password protection, things like different levels of access for different types of users, etc. Giving some people some insight into how a system protects their data is also, I think, a useful way to improve, to make them feel that the system is safe and hopefully make them more predisposed to trust that their data is being kept safe. I'll stop there because I really, my throat is bothering me. Thank you.
Thanks, Joy. All right. Thank you all for your questions. Unfortunately, we cannot address them all live, but we see the questions, and as much as we can, we will respond to them offline. But I'm going to ask our presenters to just give us some key takeaways, some call to action from our discussion today. Tariku, you are first on my screen. I don't know how you line up with other folks' screen, but you're first on my screen, so I'm going to ask you to go first and just tell us some key takeaways, some messages you want to leave with our audience.
Thank you, Stephanie. When we think about social behavior change and digital health, I think it is good to think it in both ways because it cuts both ways. We use techniques and tools of SBC, social behavior change, in the development and deployment and improvement of digital tools. So we have talked about HCD, the role of HCD in the development of digital tools, the need for continuous feedback collection from end users in order to optimize and enhance digital tools. So that is how SBC is driving the development and adoption of digital tools. There is also the other side of this. Digital tools also help to bring about behavior change among communities and health providers. For example, alerts may remind healthcare providers to take certain actions. There are also digital tools that improve adherence to TB treatment because they regularly send reminders to patients. So digital tools themselves also help bring about behavior change. Change can be in the form of, for example, taking actions when there are procedural alerts or when there are reminders sent to clients or patients that are in some sort of treatment. So when we think about the nexus between SBC and digital health, it has a feedback loop. Like SBC helps improve the development and adoption of digital tools, while digital tools on their own also help accelerate or bring about desired behavior change. Thank you very much.
Wonderful. Thanks, Tariku. It's a wonderful way to talk about the feedback loop. Judith, your takeaways. I'm going to give everybody about a minute because we are running out of time. So Judith, your takeaways, your call to action, what you would like our audience to take away from this discussion.
So mine is just to remind everybody, digital tools, digital health is the way to go, because we shall get real-time data, we shall get accurate data, there'll be efficiency in performance, and there'll be workload reduction. So that's the way to go because of the technology. The world is a global world. We are moving in the digital way. We are not going the analog way. Thank you so much.
Thank you, Judith. Do not be afraid is your message. Wonderful. Wesley, you're next on my screen.
Yeah, so mine, I think I'll just be able to say that key to success in any digital dispensation is number one, ensuring that you involve all the stakeholders, because anybody you leave behind, anybody you assume is not important, is going to cost you at the end of the day. Have a very well-planned system of how you're going to do change management, and at the back of your head, please know change is always resisted. So the best way to package is to ensure that you make small infeasible changes until people do not realize actually the change has already occurred, but more of they become key disciples of your change. Lastly, have a champion in whatever system you're running out. And lastly, but not least, have a recognition and reward system for those who are doing very well. And generally, with such small things, all incorporated into one good stew, you'll be able to achieve digital transformation. Thank you.
Great, thanks. Stealth change. All right, Joy, over to you for your call to action, your takeaways.
Yeah, just to reiterate Wesley's point that change management is key, and really to say that, change management is not just about training. We tend to think about it just as training, but it really starts with involving the user right from the beginning to inform the design and implementation of a tool. And, that really, we should be thinking of change management as not just happening after digital implementation, but really it should be happening during and even before digital implementation with all your stakeholders. As Wesley said, leave no person behind. Thank you.
Thank you. Thank you all. And thank you to our distinguished panel for sharing your thoughts and experiences, and to our audience for the questions that you asked that enriched this discussion. Before we leave, I wanted to share some concluding thoughts from our conversation. We heard how using behavioral science can help us better understand barriers to change for the adoption of digital tools, help us design and tailor interventions, and enhance communication that builds trust, which in turn can build a culture of change. And we also heard that by applying behavioral science to the challenge of digital transformation, we can navigate the complexities of digital health transformation more effectively. So ensuring that the solutions are person-centered and not only implemented, but also embraced and sustained. So just thank you all for being here. We will share the recording of this Behavior Effect livecast on our website, jsi.com, within the next few days. Thank you all for joining us today. Please take care of yourself and your loved ones. Be well until we meet again.
Thank you.
Thank you.
Thank you.
Thank you.